Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. In this segment, we're going to be speaking with Dr. Bruce Dorr. He's joining us here as an OBGYN at Littleton GYN Wellness Balance Hormone Health Center to discuss menopause, the wide range of symptoms associated with menopause. He's also going to talk a bit about why women and healthcare professionals alike often don't recognize or maybe misdiagnose some of these symptoms of menopause. Welcome to Health Professional Radio, Dr. Dorr. Thank you so much for taking the time on this very important topic.
Great. Thank you. Thank you for having me. I appreciate it.
Well, give us a bit of insight into your background. Was OBGYN your first love in medicine?
Well, actually, I went into medicine to become a psychiatrist. I was a mental health advisor in a lockdown ward in Louisville, Kentucky. I just loved it, but as I got into medical school, I didn't want to go through the rest of my life thinking everybody was crazy. It's a thing that way, too. So I enjoyed the medicine. I enjoyed everything about OBGYN and found that the love for both surgery, certainly in developing through pregnancy and everything else about OBGYN, just really felt right to me as the thing that way, too. And certainly have loved it as I've, gone further in my career. I'm actually now subspecialized as a urogynecologist, which is the fourth segment of OBGYN medicine is the thing that way, too.
Well, as I said, our target audience is healthcare providers, but just a little insight into what menopause is. There are many misconceptions surrounding menopause. Let us in on what menopause actually is.
Well, the definition through the American College of OBGYNs is when women have stopped their menses for greater than a year. But what happens is the time leading up to when their cycles stop altogether are highs and lows of estrogen production. So estrogen is made by the ovaries, and during ovulation or releasing that egg when trying to conceive is estrogen's counter hormone progesterone. So it's the rise and fall of those hormones and the irregular production leading up to when that stops altogether. On average, that's age 51. But it's more the perimenopause that really drives a lot of symptoms. And that can start for women as early as their 30s with loss of hormones. And so that rise and fall leads to many of the significant symptoms which can affect them throughout their career, throughout their lives, and throughout their relationships is a thing that way.
Now, once symptoms start, as you say, as early as in their 30s?
Sure.
Once these symptoms start, are you actually experiencing menopause, or can this process take a long time to actually be at that point where you're not having a period for 12 months?
Those symptoms can start much earlier, and there are some women that never get rid of their symptoms. I have women who even 5, 10, 15 years after their cycles have stopped still do not sleep, still experience night sweats and hot flushes, and live kind of miserably. There's other women who don't experience any negative symptoms. So that's why it's very frustrating, and certainly frustrating for the medical community because it varies so much. And if you're not trained to recognize it, it's a real issue for your patients.
Well, are most physicians trained to recognize the symptoms of menopause, whether they're an OBGYN or not?
Actually not. When they did a survey recently, about 80% of physicians in general are not comfortable treating menopause. Only about 20% of residency programs offer any kind of training, and those are more elective courses. So the problem is, in general, treating hormones is difficult, and it's difficult to understand. So when you offer elective courses like that, the other courses, say in surgery or advanced obstetrics or things like that, are much more, much more taken than talking hormones, because it is a little bit more difficult and involved topic that's not quite as sought after as, say, the other courses as a deal that way, too. So we have very few people that are really prepared to handle women during this kind of critical time.
Well, I understand that it's an estimated 1.3, 1.4 million women here in the United States enter menopause every year. With that many people having a condition ongoing forever. It's not going to stop. Are some of these symptoms, do they mimic other conditions so much that it's misdiagnosed or often overlooked even by the women themselves? It would seem that there would be a lot more focus on something that happens so frequently.
Sure. And, yes, those symptoms, of menopause, I see, women who come in, and the women that come in to me don't necessarily realize that it is menopause. They'll start experiencing irregular bleeding or irregular periods. They'll have vaginal concerns or dryness. And me as a urogynecologist, like I said, it's called female pelvic medicine and reconstructive surgery. I have many women who come in to me with bladder issues, incontinence issues, and things like that. And that's the number one reason, that and the irregular bleeding, that women come to me. But there are many women who have been the gamut, certainly to their primary care with, say, weight gain or depression, irritability. But I've seen also many women who have been to their primary care and then they go to subspecialists like cardiologists because they have palpitations, they have irregular heartbeats, they experience panic disorder, and they do this whole workup with cardiologists, and they're all negative or normal. Mm-hmm. And they get very frustrated with that. Women will sometimes have weight gain, and they'll see an endocrinologist who draws labs on them and says that they're normal. They'll go see rheumatologists who they're worried because their joint pain is so bad, and so they get a full workup from these joint and bone specialists, and they're all normal from that way too. I've had women who. I had one woman, she was just skiing up in the mountains, and she had fractured her leg, and she presented with osteoporosis, and it was really more menopause related, and many subspecialists, call them normal, even though it's really menopause related.
With so many women in the workforce, I'm sure this poses a problem with back and forth diagnoses, back and forth seeing different doctors for a problem that many aren't trained in, and maybe the woman herself doesn't understand what's going on, and you've got to maintain a career.
Right, exactly. So, sometimes these symptoms are so bad that, up to 4% of women will actually quit their jobs because of how bad these symptoms can be. Mm-hmm.
Do you think maybe more training earlier in a physician's medical career about menopause is the solution?
Yeah, I think that certainly everybody should be aware of that. Unfortunately, medicine and the topics in medicine, it's just so broad. It's just everybody's got their one little segment of area to kind of work around or to be good at. And luckily, we're seeing more and more people, especially with the parent group that I'm involved with, to recognize how important this is for women and how important it is for our society as a whole to recognize this segment of the population, which can be misdiagnosed. It's just as important as cancers or other things that way with how much it's affecting our population and our women.
Give us a website where our listeners can learn more.
Yes, I am affiliated with Biote, and the website is biote.com. That's BIOTE.com. And that is, we are 5,300 providers strong. We're now a publicly traded company. It's on marketing and training and promotion to help women with bioidentical hormone replacement. It actually follows much more of a functional medicine philosophy. So it's about nutrition, it's about vitamins and minerals, and it's about putting back into the body the same stuff that was meant to be there in the right way, rather than pharmacology alternatives that can have very negative side effects that many women suffer from or have negative problems if people aren't trained in in that kind of alternative therapy.
Dr. Dorr, it's been a pleasure speaking with you. Lots of great information. I'm hoping that we'll have an opportunity to speak again.
All right. Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Bruce Dorr. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.